Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 295. As of this morning, there are no cases in hospital or in the ICU. As of this morning, 278 individuals are listed as recovered, and there are 10 active cases. Yesterday, 806 lab tests were performed, bringing the total to 44,692. We had 2 cases late last week that we noted were related to travel. We can confirm that those 2 cases were in truck drivers that had multiple routes through a number of the U.S. states. And certainly it's important to know that these individuals took all the right action. They became symptomatic soon after returning. They were self-isolated, were tested, and there is unlikely to be any significant contacts in the community in this regard. Because of Manitoba's numbers being favorable, we know that our major risk is to importing this virus from outside of Manitoba, and so we certainly know the essential need to continue supply chains going, and that includes transportation such as truck drivers. But we've now expanded our asymptomatic testing to be offered to truck drivers who leave the province for their work. So they are now able to be tested asymptomatically. It's certainly voluntary. It needs to be voluntary, but certainly an option to continue to try to reduce our risk for that. And we've been working with the Manitoba Trucking Association in that regard and had great collaboration on this step. And so expanding that to asymptomatic testing will again give us a little bit more of a risk reduction, even though all of these individuals have already been taking a lot of precautions in order to prevent the importation of the virus and spread. But this will just give us more indications of the spread of this virus. So again, with asymptomatic testing, it's important to note that it only tells us at that specific time whether a person is infected. Certainly a negative result in an asymptomatic person can't be relied on if symptoms develop soon after. That person still needs to take appropriate precautions, stay home when they're ill, and then be tested should they develop symptoms. We had a case reported over the weekend, and again, this one is related to travel as well. This took place in a temporary foreign worker, and again, all the appropriate actions were taken in place. There was appropriate self-isolation, and so again, very limited contacts that we feel in that regard. Just further solidifying the need for the precautions that we have in place. Of course, public health is still following up with these individuals, and further details may follow. So phase 2, day 1 is today, and so because of Manitoba's favorable numbers, we've been able to continue our progress with reopening the economy. Again, it's not that return to normal. We have a broad reopening, but with restrictions, and Manitobans are well aware of all the precautions that they take, washing their hands frequently, maintaining that physical distancing whenever possible, and very important going forward, very important to our success, is staying home when you're ill. Again, we can't have people fighting through colds at work or going out in public showing symptoms of respiratory illness. Those people should stay home, certainly seek medical attention if necessary, get tested for COVID, but we can't have people out and about showing signs of respiratory illness. So again, those people with symptoms of COVID-19, fever, chills, headache, cough, sore throat, runny nose, even if they're very mild, to present for testing. We want to be able to ensure we're catching cases very early so we can isolate them and do contact investigation. It's going to be very important for our success to move on to the next phase of our reopening. So again, those individuals that are high risk of the severe outcomes of COVID-19, those over age 65, those with underlying medical conditions, which include especially respiratory and cardiac conditions, those with immune compromise are at increased risk of the severe outcomes of COVID-19, so you have to take extra precautions at this point. Certainly lots of hand washing, avoiding large groups, avoiding crowded places. Do what you can to reduce the chances of being exposed, because certainly you're at more risk of the severe outcomes. So again, people can visit our website, manitoba.ca/COVID-19, for up-to-date information. And thanks again to all Manitobans, and I'll pass it over to Lanette.
Thanks, everyone. Thank you, Dr. Roussin. Sorry. So I would like to start by thanking Manitobans for over the past couple of months. The random acts of kindness, the generosity has been so appreciated. I want to thank you for your response to following the public health orders and the recommendations. It is because of that that we are in the phase that we are in now. And I also want to thank Manitobans for your patience as we have tried to balance the safety of trying to reduce the spread of COVID-19 among our staff and patients while still maintaining compassion. And I know that has been really difficult in terms of the visitor restrictions. So while we have already made adaptations to the PCH, I'm happy to say that we have developed some guidelines for inpatient visits. They're just going for consultation now, but I expect to have more details at the end of the week or sometime this week in terms of when we can start those. But it will ease the burden that I know many of you are feeling, and I appreciate how difficult this has been, and so we're looking forward to sharing that with you soon. I also want to let you know that as of today, Victoria Hospital, which has a lot of long-stay patients, has decided to do a pilot in following those PCH guidelines and allowing outdoor visits for medically stable patients who can go out and visit with their family and loved ones. So that's starting at Victoria Hospital. We'll look at whether we can accommodate that at other acute inpatient facilities, and because we know how important that is. So just wanted to give you an update on that, as well as I'll provide you with some statistical updates. So there are no new cases involving healthcare workers or first responders since I last reported. Last week, 429 healthcare workers and first responders were tested for the virus. And since the pandemic started, 26 workers have tested positive for the virus related to non-travel reasons. And as stated, 26 have recovered and are back to work. HealthLinks received approximately 5,000 calls in the past week. And a reminder that Manitobans no longer have to call HealthLinks or see their physician to receive a referral for testing. They can self-refer themselves if they are showing symptoms and have used the online screening tool, which can be found at manitoba.ca/COVID-19. That screening tool has received more than 631,000 web hits since its launch, including 35,000 in the past week. So again, if the screening tool shows you meet the criteria for testing, we strongly encourage you to just go ahead and go to a community testing site. And finally, I wanted to just provide an update on the reusable N95 respirators designed by a team led by Dr. Petropoulos and Dr. Robertson, and those are those 3D masks. Health Canada formal approval continues to be in process. The staff at Precision ADM were trained last week on how to make these respirators, and assembly is now up and running with an expectation that it will soon be producing up to 150 N95 respirators per day. These will be optional use for surgical staff, and evaluation will be ongoing. And of course, quality control measures will be in effect prior to distribution. So with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one opening question and one follow-up question. Up first this afternoon, from CBC Manitoba, Aidan.
Hi, Aidan from CBC News. My first question is for Dr. Roussin. Can you give us any additional information on the temporary foreign workers? Where did they come from and what sector were they working in, and were they able to follow self-isolation requirements for the 14 days following their arrival and so on?
Yeah, and so I think that what's important information here is that it's a travel-related case. It is with a temporary foreign worker, and yes, the self-isolation period was adhered to. There was actually a number of other safety issues taken on. There was a cohorting of people there, so there was about 18 people in total in the same establishment, temporary foreign workers, none of which are showing symptoms, all of which are undergoing testing and going to be followed closely. So yeah, everything was followed appropriately, and from the public health investigation, there's no risk to the public. The reason why we want to disclose it is for that reason. As we're reopening in phase 2, we want people to be aware of where the risk is. That if it's travel related, if it's controlled, it shouldn't be a concern with the continuation of our reopening plans.
Thank you. And my follow-up, just to pivot a little bit, the province has issued a request for a quotation for serological testing kits. So what's involved in getting these kits, and what is the province's strategy for how and when to actually start doing antibody testing?
Yeah, so for the serologic testing, it's still early on. We're working nationally to develop an approach for a seroprevalence study, and so it's best to try to get a consistent approach across the nation, because then we'll have a lot higher numbers to work with to get a better picture of the seroprevalence of COVID in Canada. And so it's still early on. We're certainly ordering those tests so that we're getting prepared to be able to do that, but the details of that are still pending.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin today, as you mentioned, is the reopening, the start of phase 2. What are you looking for as you before you move ahead to phase 3, tentatively set no earlier than the June 21st?
Yeah, that's right. So, we want to see about that around that 2 incubation period, which we would say is about 3 to 4 weeks on this. So that's why that time line is in there. And we're going to follow much of the same indicators that we did for phase 1. Our positive test rate, which is, really low at this point. We're going to look at the non-epi-linked cases going forward. We'll look at our healthcare system capacity. So a number of indicators looking at trends. And so we follow those daily, and we're going to follow the trends, and we'll be watching them really closely.
And most of the cases reported recently are linked to travel. If memory serves, last time we talked, health officials had not determined the origin of the case of that retail worker in the Southdale area of Winnipeg.
Right.
Has there been any more investigation, any determination as to what the source of that case was?
No, that one we would call a non-epi-link case. That one we could not relate to travel or to a known case. So that was our last case, essentially, that would be in that category.
From CTV Winnipeg, John.
Hello, John Hendricks from CTV Winnipeg. My question is for Dr. Roussin. Dr. Roussin, gyms, by their very nature, have people breathing heavily and sweating, so forth. I'm just wondering how you would rate the danger levels at these facilities.
Yeah, so I think that there's, with anything, we're not going to get to a zero risk situation where it's a balance. We're balancing the numbers of cases we have here, balance that with the benefit of physical activity and people getting back in there. And with all the appropriate precautions taking place, the spacing, the 50% capacity. We feel that it's a lower risk situation at this point. Certainly everyone needs to be screened, right? We can't have someone coming to a gym working out for an hour who is coughing or sneezing. So that's going to be a big step in this. But with the distancing, with the appropriate sanitation, we're thinking that it's the proper thing to do at this time.
My follow-up question is for you as well. In regards to team sports, the reopening plan calls for activities such as boxing or football to be modified. I'm just wondering how, say, for example, martial arts such as jiu-jitsu could be modified when the sport requires a lot of personal contact just by its very nature.
Yeah, and so again, this is that balance that we have relatively low numbers. We want to get people out back active and benefiting from all of these activities. And then certainly no one at public health is going to be in a position to be able to know the intricacies of every sport. So what we do is there's guidelines that we forward to them. From the Public Health Agency of Canada, and each sport certainly doesn't want to increase the risk for their participants or for themselves. So they're going to need to look at their sport and review the guidelines and see what kind of modifications they can make to make things safe. Because everyone's in this together. No one wants to put people that they're training or training with at risk. So it's going to be up to those sports to read the guidelines, to find ways to minimize the risk, and certainly in nothing that we do we deal with zero risk. So it's going to be that balance.
From City News, Jonas.
Good afternoon, guys. Lanette, the question for you this afternoon. As we move into this second phase, I just want to confirm, as far as you know, we are COVID clear in our health system as far as workers and who is in the system right now?
As far as we know, yeah, the last data that I looked at, that's what we saw.
Great. I just wanted to confirm that. Thank you very much, Lanette. And for Dr. Roussin, as we head into this second phase today, again, we're coming into this on some remarkable numbers. I guess the biggest thing for us in Manitoba as we move into this is to stay the course and avoid importations as much as possible. I guess for folks to not let their guard down.
Yeah, I think so. I think that Manitobans really stepped up, really put us in a position to open things up in a very with good timing. But I think it's that safe time. I think our numbers support that. But we know that the virus is still circulating. We detect it, so we do have to maintain our guards. That's why we still have a lot of restrictions. We have a broad reopening, but with lots of restrictions on group sizes, restrictions on occupancies, restrictions for social distancing. And so I think Manitobans are learning how to live with this virus, and will stay stay involved with trying to limit the spread of it.
From the Winnipeg Free Press, Carol.
Good afternoon. It's Carol Sanders at the Free Press. I'm just getting back to Ruben's question about serological testing. BC's already invited volunteers to take part. Will Manitoba do that, or will a specific group be targeted for serological testing, or healthcare workers? I know you said you're waiting for a Canada-wide strategy, but it sounds like some provinces are already taking the initiative and starting with the plan, or at least a plan for a plan.
Yeah, so there's a couple of things when we're talking about serologic testing. So one is a seroprevalence study, and so that just gives us a better indication of where this virus was and how many people were infected, and gives us a bit better picture of that. And then there's a use of serology if we can determine whether there is immunity that's brought on by infection, and how long it lasts, and what that might tell us. So the latter, we're still learning. We don't know that yet. So at this point, when we're talking about a seroprevalence study, it's really important to pick the study groups well, so that it's going to give you a good representative sample to be able to extrapolate what proportion of the population has been infected. And so for that, we're early on. We're going to want want that national approach. I'm not sure about the specifics in those other provinces, but for the most part, we're going to look at that national approach to determine which cohorts we're going to test first.
And my follow-up question is about testing sites. Some of the sites still have signs that say appointment only or by appointment. Is there any plan to take those signs down or cover them up or anything, just so there's no confusion? I know the messaging has been, you don't have to go through health things, but for people who are not too sure and show up, it looks like you need an appointment. Is there any plan to do anything about their signage?
That's a good question, Carol. I'll take that back to our operations team. I don't know if that was an oversight, but I will follow up and highlight that we need to look at that. Thank you.
From Global, Amber.
Hi, yes, Amber McGuckin from Global News. I'm wondering, as kids can kind of go back to school in smaller groups, should they be wearing masks to the classroom, and what should they do to protect themselves and other people around them?
Yeah, so I think with the message we stick to is right back to those basics. So, and it applies to the school setting as well, is that the screening for everyone for symptoms or any high risk contacts, that's as vital. We can't have kids going to school that are showing even mild symptoms of illness. Physical distancing whenever possible. Certainly it's not possible at all times. Brief exchanges may happen, but there are ways. We're limiting group sizes. So that's important. The frequently disinfecting of surfaces also important. And then non-medical masks can be an addition to that. So it's certainly not something that is required. It's something to think about, especially if you can't maintain physical distancing. It's important to remember that non-medical masks don't protect the person wearing them. It protects the people around them, but it must be used properly. And must be, used, adhered to at all times. So, one of the challenges in say the school setting, depending on the ages, would be the chances that proper mask use would be utilized at all times. And so, it's not something that's mandatory. Non-medical masks can be considered, especially in circumstances where you can't maintain physical distancing.
Okay, great. My follow-up question is, we have seen some businesses that have had fines for maybe not following the rules. Have health inspections increased? Are they targeting certain types of businesses? I've seen a lot of restaurants getting some fines. Have there been an increase in those inspections?
Well, I think that as we reopen, there's certainly the health inspectors are quite aware of the things they're looking for. I don't necessarily have the numbers on how many inspections take place or necessarily the trend, but certainly there's a lot of work being done, and most of that is not about fines or penalties. It's about education. It's about assisting with compliance, and that's what's got us to where we are now. It's very rare that a fine has to be levied. It's most times it's just about educating and just helping places learn how they can comply with the orders.
From the Brandon Sun, Bud.
Yes, Buck Robertson, the Brandon Sun. These are for Dr. Roussin. Just to go back to the temporary foreign worker for a moment, can you tell me what health region this person works in, and if they're involved in anything food-related type of work?
So this is in the southern region, and as far as the details on there, again, public health is going to announce if there is a risk to the public on all those other details. So we want to make sure we have that balance between the privacy of the individual and risk to the public. So we wanted to make sure people were aware it was travel related to ensure that our reopen strategy keeps moving forward, that we're detecting these cases. The other details, their public health investigation's been done. There's no risk to the public in any other way, so we're not going to provide any more details.
Okay. And on my follow-up question, forgive me if I'm wrong, but I don't believe movie theaters are in phase 2. I was wondering why not, and if they're going to be in phase 3 then.
Yeah, so they're not in phase 2, and what's the reason? It's exactly the spot where we see these transmission events, right? Closed indoor prolonged contact. And so that's where we you get nervous, and so they're not included in this phase. Again, we take a phased approach, so we couldn't open everything at once. But as we move to phase three, those are things that we're going to start looking at, how they can be modified, how we can work with the groups to ensure it's safe. But as far as phase two goes, that's not included.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, do you expect some of the lessons we've learned during this pandemic to impact rates of other diseases as we go forward? I'm thinking perhaps next flu season, just as far as stuff like really good hand washing, not going to work while sick, being more cautious about distancing, that sort of thing. Do you expect any of the stuff we've kind of been doing for the past couple of months to have an impact as we go forward?
Well, this is, like we've been saying, this is that new normal that we're in, and certainly we're not going to have that person sitting next to us at work coughing all day. That's not gonna happen anymore. And certainly people are more astute to hand washing, to disinfecting frequently touched surfaces, even physical distancing. And so yeah, I think that many of the respiratory viruses we deal with, like influenza, are spread in much the same manner. And so as Manitobans are learning to live with this virus, still getting out, still reopening things, but learning to live with it, we're probably going to see some beneficial effect on those other illnesses that are spread in much the same manner. So only time will tell that, but we know that when the fall comes, we have to be prepared for a second wave of coronavirus, but we also have to be prepared for that typical quite severe virus that we see every fall, influenza.
And just as a follow-up, you mentioned the temporary foreign worker case being the most recent. How big of a concern is this kind of a situation as we get into the summer?
Yeah, so actually this situation, really isn't concerning because all the proper precautions are in place. So the period of self-isolation, the cohorting there. And so when we look at this case, all the cautions were there. So we announced this one not necessarily for to be a warning on any situation to Manitobans, just to highlight that our biggest risk is importation of the virus, and that in this case everything was managed in an appropriate manner. So we certainly want to continue with our reopening plans.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here from the Winnipeg Sun. Just a question for Dr. Roussin. Why not make it mandatory for truckers to be asymptomatic tested upon arrival, just as an extra layer of, I suppose, precaution when it comes to the reimportation of the virus?
Yeah, so this is not really the public health way on these things. If we have people who are asymptomatic, like we said, the value of asymptomatic testing is not anywhere near the value of testing people who are symptomatic. So we wanted this to be an additional precaution that's voluntary, because remember we need this transport. We need these truck drivers, and from all the information that we have, the collaboration, the good collaboration we've had with the Manitoba Trucking Association, is that they're all following our advice. So this is something that's just in addition. We want it to be voluntary because already from what we see is that the Trucking Association is really following all our guidelines. So this is just something on top of things.
Sure. And just a second question or a follow-up here. Obviously, a lot more tests on Sunday. I assume some of those at least were asymptomatic. How many asymptomatic tests have been done now, if you have that? And are you seeing, are you surprised that there's, very few cases cropping up from those tests?
So actually, I didn't bring the exact number of that. That's been steadily increasing over time. But I'm not surprised that we're not picking up more infections because we know that the highest risk group are those that are symptomatic, and when we are only testing symptomatic individuals, our positive test rate was quite low, well under 1%. And so when we open it up to even lower risk groups, we're going to expect that percentage to even drop further. So it's not surprising.
Thank you. We have a few minutes left for this session. If the reporters on the line have any further questions, please proceed.
Hi, it's Carol.
Hi,
It's
Aiden.
for Lanette. I just want to know, how is the province's PPE supply holding up? Are we stable? What's going on with PPE now that more businesses are opening and there's more people looking for PPE?
Well, I believe we're in a okay state right now. I usually get updates on a couple weeks in advance. Our logistics team continues to work with vendors and make orders and await the shipping. So I haven't been alerted of any concerns at this point. Part of what we're doing right now is that we are sustaining what we have, but we're also looking to ensure that should there be a surge in the fall, that we have a good stockpile available to us. So work's ongoing for that.
Aiden from CBC News. A question for Dr. Roussin. Can you tell us when we might hear more about serologic testing in the province?
Yeah, I don't know exactly date. I think there's a lot of work going on right now at the national level on this. So, I can't comment on a specific date. I'm thinking, within the next few weeks, certainly we should be getting things together to start proceeding. But it'll depend on a number of factors.
Hi, Aiden from CBC again with another question for you, Dr. Roussin. Or perhaps Ms. Siragusa, is Manitoba still stopping traffic at Saskatchewan and Ontario borders? And if it is it still happening as a regular occurrence?
Yeah, we've been slowing down that aspect. What we found was a number of the people that were stopping. It was just repeat times or seeing the same amount of people. So I think the message is out there, and that's not the only thing we're doing. We have signs out on there. We've done a lot of education on it. So as things have shifted, as the numbers have shifted, we've slowed down some of those checkpoints.
All right.
Hi.
Thank you, everyone. This concludes today's media briefing.